VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Our number is 954-717-7027. We're a Medicare certified home health care agency in Palm Beach County, Broward, and Miami-Dade. I'm your host, Louise Gomez, and today we have Dr. David Margolis. He is at 9980 Central Park Boulevard, Suite 314, right here in Boca Raton, Florida, 33428. He can be reached at 561-488-3113, and the email to reach him at is Margolis, Margolis, office at bellsouth.net. Thank you so much for joining us, Dr. Margolis.
Hi.
Hi. We appreciate you coming and taking your time out of your busy schedule. So you're right here in Boca.
Yes, I am.
And how long have you been here? How long have you had your office?
I've been here for over 20 years.
Wow. So
Yes.
you're pretty well known, I would say, in this area. Can you tell us a little bit more? Can you tell our viewers and our listeners a little bit more about what's your background? Where'd you go to medical school? A little bit more about your history and whatnot.
Sure. I'm from Minneapolis, Minnesota, so I attended the University of Minnesota undergrad. From there, I went to Dallas, Texas, the University of Texas Medical School at Southwestern in Dallas, Texas. Did an internship at the Stanford Hospital, Stamford, Connecticut, and then residency at the Brookdale Hospital in Brooklyn, New York,
Oh, wow.
and the Yale-affiliated surgical program in Bridgeport, Connecticut.
Wow. So
Yeah.
you've been around. You've had a lot of experience. Good for you. What can you tell us a little bit? What is your medical specialty?
So I'm a general surgeon, which means I'll handle pretty much anything in the abdomen. We'll do breast surgery for breast cancer-related things, no cosmetic surgery.
Okay.
I do any lumps and bumps, lipomas, sebaceous cysts, any bumps, and of course, lots and lots of hernias.
Okay, it sounds like that's your kind of like your specialty, right?
We do more hernias than anything else.
So what is the age range of your patients, if you can just give us a little bit information? Because my son, it was interesting, I'd never known this. My son was like, I don't know, 11, 12, he had a hernia. I was like, what? How is this possible? In my mind, I thought a hernia was for, like, quote unquote, an older person, you know?
No, you can see hernias at pretty much any age.
Wow.
Babies are born with hernias sometimes. You can see them in younger age groups. They're a little bit more common as you get older rather than younger. For inguinal hernias, which are...
What is that?
That's a groin hernia. Inguinal hernia is a groin hernia. That's more common
I was going to ask.
Yeah, more common in men than women, but you can see it in men and women. But they can occur at any age.
So to get real quick technical, so a hernia is where the intestines actually push through the can you explain? I'm asking because I'm totally don't remember.
Yeah, so basically a hernia is a hole, and typically patients will come to the office because there's a bulge that they can see. For a groin hernia, the bulge will be in the groin, or you can have umbilical hernia where the bulge is at the navel, or ventral hernias. So any of those hernias, there's a hole, which is what the hernia is, and then the bulge is your insides coming out of the hole.
So I know somebody who had also the one here. What is that? The
ventral hernia.
Ventral hernia. And so is that something that needs to be addressed right away as well?
Yeah, ventral hernias, we do recommend repairing those.
Interesting. How do you diagnose a hernia? Like if people are maybe, unsure, or what, they're not clear on what they have, how would they know to go to see you?
So the most common symptom for a hernia is a lump or bulge or swelling. And the bulge will be at the site of where the hernia is. So with the inguinal hernias, the bulge will typically be in the groin, or if it's an umbilical hernia, the bulge will be at the belly button. And that's the most common symptom. Sometimes people will present with pain or discomfort, but more often than not, there's an actual bulge there, and that's the main reason. So what happens when they come to the office is we'll look for the bulge. Sometimes the bulge is reducible, meaning you can push it back in. If you have a bulge that's reducible, that's a hernia. There's no doubt. There's no other bulge that you can get that you can push in, and there's nothing else it can be. If it's a bulge, you can push it in. But if it's a bulge, a lot of times it's a hernia. Or it could be other things. It could be a cyst or a lipoma or something. But typically, if it's in the right spot, it'll end up being a hernia.
So how is that repaired? I'm trying to remember, I don't know if with my son they used a mesh. Is that common to use like a mesh, or how is that repaired as far as when you are going to fix that? Is it?
Right, depending on the type of hernia. With the groin hernias, the inguinal hernias, for example, those typically will get mesh. Umbilical hernias, which is the belly button hernia, typically those can be repaired without mesh. Ventral hernias, incisional hernias, the other hernias, it depends, but yeah, frequently mesh on some of those too. It depends on the size of the hernia, location, and other factors, whether it's a good idea to put that in or not.
I see. And what is the reoccurrence rate as far as what percentage? Do you know what percentage that people would have to come back to fix that?
Right. With inguinal hernias, it's about 1% recurrence rate, about 1 chance in 100.
Wow,
that the
that's
hernia
pretty
comes.
good then.
Not so bad.
That's not so bad, right?
Not too bad.
No, because some people are I would imagine some people who have a fear of surgery and they, are fearful of it, it's good for them to know that, you have a very high success rate, and they can take care of that and treat that. What happens if you leave it alone? Because some people do, they have a fear and they don't want to see a doctor, and that's the reality of it. What is the reality of if they leave it alone? What would happen?
So with the inguinal hernias, especially the groin hernias, if they're completely asymptomatic, if they're not bothering people at all, if they're small, and you watch them, sometimes that can be safe to do. But if they're larger, or if there's any symptoms, we do like to get them fixed. Most of the patients who come in, I do recommend repairing the hernia.
Makes sense.
What happens is the hernias will only get bigger with time. If you leave them alone, they'll gradually enlarge. Sometimes they'll enlarge quickly. A lot of times they'll enlarge very slowly. It can be months, years, even decades that they can just slowly get big. It depends, sometimes more rapidly. But the one thing for sure is they will never get smaller.
Right.
They only get bigger.
Right.
And they're never easier to fix than the first time you walk in the doctor's office, because that's when they're the smallest and
true.
easiest to fix. Also, the other thing is the patients are never healthier than the first time they walk into your office.
This is true.
Patients, like one thing I'll tell patients is you come into the office, typically they're perfectly healthy except for the hernia. So they'll come in and surgery is going to be super safe to do. But if they wait, you never know what's going to happen. Like maybe you have a little itty bitty heart attack. Not a big deal, everything's fine, except now the hernia is really bothering you and the surgery is really dangerous because you just had a heart attack and now the risks are super high. So I usually encourage people to go ahead and get it fixed while it's smaller, everything's really safe. Most of the time it's a good idea to just go ahead and get it done.
Now I had a question. Is this hereditary? Is this what people would consider to be hereditary? Because the first thing I thought of was like, oh, I don't know anybody in my family. Why would my son have this? Right? So is this genetic or what? Or is it just something that he did in sports, or?
It's both.
Okay.
It's both.
Thank you for
So-
clarifying.
Yeah, so genetic factors, in other words, if you have hernias in your family, if your father had a hernia, if other people have had hernias, your risk of getting a hernia is higher. So genetics definitely play a role.
Sure.
But just because other family members had them doesn't mean you'll get it. So it plays a role, but it's not the only factor. The other factor is how much stress you put on the area. So things that increase abdominal pressure, like say doing sit-ups or lifting heavy weights, that increase the pressure in your abdomen. The pressure goes every direction. You can't have pressure in the abdomen and not pressure in the groin. If you have pressure, it goes every direction. But even more than lifting heavy weights, coughing causes even more pressure than lifting weights. Sneezing, if you're straining to go to the bathroom, all these things can cause pressure. So the amount of strain you're putting on will also affect whether you're going to get a hernia or not. One of the examples I like to use when people come to the office is the weightlifters, the Olympic 500-pound guys, the people who really lift a lot of weight. The weightlifters have a much higher incidence of inguinal hernia than people who don't lift 500 pounds. So lifting 500 pounds and being in the Olympics very markedly increases your chances of getting a hernia. But not every one of them get it. Some of them lift 500 pounds all day long and they never get a hernia. So in those people, the genetics in their tissues and such are strong enough that they just never get it. Other people, like babies, for instance, they never lifted a weight in their life and they have a hernia, so that's purely genetic. And then there's everything in between, where if you live a really sedentary life, maybe you won't get it, but if you're super active, then maybe you will. So it's the whole range.
Interesting. Would you recommend somebody who's lifting those kind of weights to wear, I've seen these people wear these like belts, you know, those weight belts. Would that help at all, or is that not?
Yeah, the weightlifters, I understand. I'm not a weightlifter, but yeah, I understand that that's recommended for the people who lift the heavy weights to wear the weight belts when they do that.
Yeah, I feel like it might somehow keep that, you know, the pressure from doing that. So we're going to have a commercial break. And when we get back, we're going to talk a little bit more about, you know, maybe different scenarios of different patients that you had, and you can share a little bit more. But we're going to have a quick commercial break.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thanks for tuning back in to the continuation of You and Your Doctor. We have Dr. David Margolis right here in Boca Raton, 9980 Central Park Boulevard, Suite 314, Boca Raton, Florida 33428. You're going to want to write his number down if you know anybody who needs his services. The number is 561-488-3113, and the email is margolisoffice@bellsouth.net. So, Dr. Margolis, we were talking about the surgery, and maybe we were saying some people, have that fear. If there's anything that you could say to maybe ease their mind, like what is that surgery like? What does it entail, and how long would that take? Or maybe shed some more light on that surgery.
So the surgery usually goes super well, and the patients usually are really happy after they've had it done. We do the surgery under what's called local and sedation.
Okay.
So that means that we numb the area up really good with a needle and a syringe, but before we stick any needles in anybody, they get medicine intravenously to be, it's sedation, so you're asleep, but very, very lightly asleep. So just asleep enough that we can do the surgery under the local, and you won't feel anything, no pain, no discomfort at all during the surgery. And then the beauty is with the very, very light sedation is when the surgery's over, you turn off the sedation and people wake up feeling really fresh and really good. It's not like a general anesthetic.
I was going to say, because general anesthetic is you come back a little more groggy and a lot more to recoup from. So that kind of twilight sounds like it's a lot.
Much better.
Nice.
Much better. With the general anesthetic, they have to put a tube in your throat so you can breathe. With the sedation, you don't need that, so you don't get the sore throat. They don't give you the heavy doses of medications that are required with the general, so you're not nauseated, you don't throw up, you don't have that terrible feeling like you get after a general anesthetic. Usually people wake up and they just feel completely normal and like, oh, is the surgery over?
Wow,
They just feel great, and there's no pain usually after the surgery. You wake up and you just feel fine.
How long is the downtime for somebody who has this surgery? Could you tell us that?
Of course. So I tell people if you have a desk job, plan to take a week off after surgery for a desk job. For a more active job, like people who are on their feet, like a salesperson who's on their feet all day, or some stretching or light lifting, I'll recommend that they go back during or at the end of the second week.
Okay.
Full activity. And when I say full activity, I mean
sports.
full contact sports, sit-ups, heavy lifting, or anything over 25 pounds. Full activity is 6 weeks.
Okay, that
So
makes sense.
6 weeks before, you can
that makes
play hockey or boxing or anything.
Right. So, what is the main type of hernia that people have that you see frequently, that people come in and get repaired?
So the biggest, most common, the one we see
common,
most often are inguinal hernias, groin hernias.
Okay.
We see a ton of those. The next most common would be the umbilical hernias, the ones that you get at the belly button. And then the rest of the abdominal wall, the ventral hernias or incisional hernias would make up the rest of it. We see quite a few what we call incisional hernias, which are hernias that are a site of previous surgery. So if somebody had, just this last week, we had one that somebody had their gallbladder out and they had put a little hole for a port site. It was laparoscopic gallbladder, so they made a little hole for where they took the gallbladder out, and then they got a hernia right where the port was.
That makes sense.
So we fixed that, and that's called an incisional hernia because there's an incision there.
Got it. Interesting. And so you were saying, as far as people wearing, like before they have the surgery and they say, okay, I'm going to do this a month from now, can they wear something, or should they be wearing something to kind of hold it in? A truss or something?
Sure. So there's something called a truss or a surgical belt that exists that will hold the hernia in. For short term, you might be okay, but people who try to use a truss rather than having surgery to try to replace the surgery with a truss is completely contraindicated. We recommend strongly against that. And the reason that we recommend against the truss is it actually increases the risk of the most serious complication of hernia, which is incarceration and strangulation.
What is that?
Yeah, well, I'll talk about that right now, because that's something important.
Yeah.
That's the important thing we can't forget to talk about.
Okay.
So anyway, the belt will hold the hernia in. It'll make people feel better. If you use it for long term, it increases risk, so we recommend strongly against it.
Okay.
If you have your surgery scheduled for next month,
Sure.
and you're just wearing the truss for a week or two prior to surgery, that's too short a period to get
Okay.
into trouble. You probably okay to do that, but only very, very short term. I'd recommend against the truss for anything longer than that.
Wow. And so, as far as surgery, how quickly would they be able to schedule the surgery if they come to see you and then you tell them they need surgery? How long is that from the time that you see them to the time that you can schedule their surgery?
Yeah, it depends how busy the office is at the time they come. Typically, we can usually get people in within about two or 3 weeks, sometimes a little faster, depending on the situation. But yeah, we can usually get people in within about 2 or 3 weeks usually.
So I would say they would make an appointment, get in there, and then is it like an x-ray also that you'd have to do, or how does that work?
So typically, most of the hernias can be diagnosed without any imaging. So,
Okay.
So you come, if you think you might have a hernia, you come to the office. We can do a physical exam, and usually on physical exam, we can usually tell if you have it or not. Sometimes, if it's a difficult case, if somebody has very typical symptoms, but we can't find a hernia, then we'll sometimes do images.
I see.
CT or ultrasound can sometimes be useful. More often, physical exam, and that's all you need. You don't need any images. The one thing I did want
Yes,
to,
please do. Chime in.
you started to talk about incarceration and strangulation.
Oh, yeah.
And that's something I absolutely can't get off the radio show without talking about.
Please.
Because there's exactly one really dangerous complication
Okay.
of hernias, and I would be remiss if I didn't say something
Sure.
about it on the show. So incarceration is where the intestines will get into the hernia and then get stuck. Typically, it'll get twisted or
I
something will
see.
happen and it'll swell, and then the intestines that barely wiggled their way through
I
the
see.
hole swell up, and now they can't get back.
Okay.
And that's called an incarceration. And then depending on how tightly it's twisted,
Got it.
it can cut off the blood supply to the intestine.
Got it.
And if you lose the blood supply to the intestine, then the intestine can die.
Okay.
And I've seen it. It happens
yeah.
it happens every so often that you'll have a dead intestine inside the hernia,
Right.
and then you have to remove it. You have to remove the segment of intestine that died. Sometimes you can remove it right through the cut from the hernia. Sometimes you have to do a real laparotomy, which is a big incision from the pubis to the xiphoid, big
Wow.
abdomen. Sometimes you have to do that if you get into that strangulation
Okay.
situation. So you definitely don't want that. And depending on how tightly it's twisted, if it's a really tight twist and no blood's getting in,
Right.
you can have as short as 6 hours before the
wow.
intestine dies. If it's not such a tight twist, you may have longer, but it can be short if it's tight. It can be. So let me tell everybody who's listening, just in case it would happen, just what to look for and what to do if you get one.
Yeah.
So typically the hernias, a lot of times, they'll stick out. You can push them back in. When it gets incarcerated, it changes, and it's usually really obvious. There's no mistaking. You're not wondering.
Yeah. You know it.
You do. It gets much larger than it was. So the
Yes.
bulging that you see is bigger. It's harder, and it's really tender when you push on it.
Wow. So moral of the story is we're not going to wait. People have this, right? They need to address this right away. We have a minute left, so we're gonna
okay.
So we're gonna really just let them definitely
Go straight to the ER, call your
yes.
doctor, get in right away if that happens.
because I mean obviously see the doctor, I think, before any of that
Yeah,
happens.
get to the doctor ahead of time and
Ahead
avoid
of
all
time
that.
to avoid all that.
Yeah,
Yeah,
exactly.
yeah. Well, we want to thank you for coming on, and we're going to switch gears real quick. I wanted to let everybody know that Dr. Margolis has a band, Revibe Band.
Yes.
I am so excited. Tell us real quick. You got 30 seconds.
Yeah, 30 seconds. So the name
Tell-
of the band is Revibe. R-E-V-I-B-E. B as in boy, Revibe. We used to be the Vibe,
Got it.
and now we Revibe. We play best of the 60s, 70s, 80s, and today. It's a really good, fun band, high energy. We have a young lady who does the singing for us,
Nice.
guitar, bass, drums, keyboards. We play all the local places around Boca
Thank
Raton,
you.
Beer Garden, Sharky's, Lefty's, May 5th. Cinco de Mayo, we're at Lefty's. Come out and see us.
Thank you. This is the kind of doctor that you want to see, a cool doctor. Thank you so much for coming. I
My
appreciate
pleasure.
It. It's been
Thanks
a pleasure.
so much.
Thank you for tuning in, everybody. Have a great night. Take care.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-24